Clock. Hope you're having a good morning so far. We're going to take a little break from the music and find out about something that's a really cool concept, the notion of having your own personal physician, if you will, and you're basically a member of a family medicine practice. That might be one way to best describe it. Dr. Sharyl Truty joins us. She's a big part of our family here at WSOS. She's also my personal doctor, and despite being my personal doctor, you've decided to stay in medicine, right, Dr. Truty? I haven't scared you away.
No, Kevin, you have not scared me away as of yet.
Yeah. Adrienne is here as well, and she is a physician's assistant and also a key member of the team at Balanced Physician Care. Go to the website, balancedphysiciancare.com, and of course, located right here in our neck of the woods, and also with a new office presence here in St. Augustine, at least one day a week, right, Doctor?
Yes, yes, we've continued to grow as a practice, and we have a presence and people that we take care of who are members in the St. Augustine area. And so, again, in the spirit of making things convenient for our patients, we have a location where we're here Monday mornings here in St. Augustine. All that information is on our website, balancedphysiciancare.com, for anybody who that might spark an interest for.
Yeah. This is a unique approach to medicine, although it's been around for quite some time. A lot of you out there listening are frustrated, by trying to see a doctor, trying to see your own family physician. Sometimes it may take 6 months just to schedule a physical, especially if you're new to St. Johns County. We have about 1,000 new residents a month moving here. Hard to get to see a doctor. When you actually get to see a family doc, you may feel rushed. You may feel like you only have 10 minutes to get in and out. That is not what happens at Balanced Physician Care, right, Dr. Trudy?
Yes, I mean, really, I think healthcare has for good or for bad gone in the direction where, oftentimes, you're seeing your provider for just a minimal amount of time. You're waiting in the waiting room, you're dealing with staff that you're not familiar with. And I just hear all over the place how people are just frustrated with that and they want to, be able to take good care of their health. There's always barriers to that, and they want the process to just be easier. And what our model really provides is patients to be able to make healthcare easier for them so that they can meet their wellness goals easier and not have these barriers that keep from them from being their best selves.
Yeah, and the way that presents itself, because I'm a patient of Balanced Physician Care, is that you have very quick access to healthcare professionals. Adrienne will have to deal with an email from me asking some ridiculous question, but yes, she responds right away. It's unbelievable. But seriously, if you have an issue with a prescription, or you wake up tomorrow morning and you have a really bad sore throat, maybe you're running a little bit of a fever, you're thinking to yourself, "Wow, just suffer through it," because you don't want to deal with going to the
Right.
ER or a care spot or trying to get your doctor on the phone or even your office, the doctor's office on the phone. In your practice, Dr. Chudy, it's encouraged that we actually reach out and let you know what's going on, right?
Yeah, absolutely. I mean, just the other day I had a patient, who, had seen and gone somewhere else, because they were out of town, and they had questions about what they were prescribed because, the interaction for them, they didn't really understand all the medicines, all the subtleties. They were reading the bottle, they were reading warnings, and they weren't sure, how that worked for them. And all they had to do was just send us a quick email. Adrian and I get on the phone real quick and just kind of take that time to explain to if you come to us, or we do online and virtual visits, we're going to spend that time explaining, okay, these are the details of our plan, and this is exactly how it's going to work. And if for some reason you still have questions, yeah, we're just an email, a phone call, even a text. We now have a online texting system that's secure away.
Yeah. That's Dr. Cheryl Trudy. If you're just hopping in your vehicle, and of course, she is the physician owner of Balanced Physician Care, balancedphysiciancare.com, the website you should check out. And Adrienne is with us as well. And she is a physician assistant and a key part of the team there. So there's a membership fee that you pay each month, which is minimal. But because of that, right, Dr. Truty, you don't have to take on thousands of patients. So you have
Right.
more time per patient. That's the concept in general, right?
Right, and I know people are like, "Oh my gosh, another, fee for healthcare," or, but really, if you look at the monthly fee, it's very affordable. Most of us, when we're looking at health plans, and making choices for the upcoming year, we're comparing plans, and I think a lot of us, if we knew that, we would get, this kind of access, paying an extra, 50 to 75 bucks a month, is worth it for, what you're able to get. And so, really we've tried to make that cost affordable, and that's what we're all about.
I think too, it's an option. I mean, I know perhaps not an ideal option, but so many folks out there listening to us, whether they're self-employed or they're consultants, working for themselves, they can't afford health insurance. They're not Medicare eligible just yet. Not ideal, but this would be a good option though, right? Because it's so much less than a monthly health insurance premium. At least do this, right?
Right. I mean, we really want to get the word out there that there is another option besides health insurance, that you can take our monthly membership. This is called direct primary care. And you can couple that with a health share. There are many of those out there. We're familiar with them. And they, are very good options for catastrophic care. The one that we happen to use a lot, but there's many of them, is Sedera, and they actually give you a discount if you're part of our membership. They'll give you a discount on their monthly fees. So it really is kind of this combination. And what's even more exciting is there is a direct primary care out of the Midwest, that is working on an insurance plan in the future. So in 2025, we may actually even have an insurance plan option as well. So we'll keep you posted, Kevin, on exciting things.
That's Dr. Sharyl Truty, once again, a physician owner at Balanced Physician Care, right here in our neck of the woods. They are accepting new patients. You can also follow them like I do on Facebook, and there's also good information there. Dr. Truty, too, also is accomplished in the area of sports medicine and also in the areas of more holistic medical practices, including acupuncture too. And you're able to integrate regular stuff that your normal physician would do, an internist or what have you, along with things like acupuncture, correct?
Yes, that's one of the unique things about our practice is that we're very open, and we are integrate holistic care into our practice. So we try to keep one foot in both worlds. We're both Adrienne and I are very knowledgeable about supplements, about various diets, about all different kinds of lifestyle medicine and herbal therapies, and I do acupuncture as well. And so we integrate that into our practice with our premier membership level, so that people who really kind of want to try to have the best of both worlds, can have that opportunity.
And let's face it, that's a rare combination. There are not a lot of medical doctors out there who are also professionally licensed acupuncturists.
That's correct. There's a few of us that are doctors who've done training in medical acupuncture, but like you said, they're few and far between. And so I had the privilege early in my career to have that training. And again, it's something that we offer to patients who are really, they're looking for solutions beyond just another prescription pill. If you're kind of frustrated that when you go, you just get another prescription, that's not what we're about. We're about try to get to the root of the problem, they say.
That's Dr. Sharyl Trudy, of course, medical doctor and also physician owner at Balanced Physician Care, located right here in Northeast Florida. With an office here in St. Augustine, they are accepting new patients. So if you would like to have, kind of a throwback experience with a doctor, Marcus Welby, if you're of a certain generation, you might remember that. But the ability to communicate with your physician or a physician's assistant and be able to get a response very quickly, or a team that's very responsive. And it's not to be critical of our existing doctor's offices around, but some of them, you get the feeling they're so overwhelmed, Dr. Trudy, that they just can't handle when you call asking about a prescription refill need, or, that you woke up this morning feeling like garbage and you want a Z pack or whatever. They can't seem to process those requests in a timely fashion, but you all can.
Yes. I mean, I think it's not like you said, it's not about, I think, the individual providers, but it's really the system that has sort of forced this sort of way of doing things. And just they're just not able to handle that volume. And certainly there's could always go into, a debate about what those reasons are, but in the end, I think it affects people's health. And so, we really, want to be able to say to patients, "Hey, there's a better way that you can do this, and it's affordable, and just take a look at us, and look at, what, we're able to do, and help your healthcare just be better, knowing you have someone in your corner." Adrienne, works very close with me, and we work together as a team. And so, both of us as providers, are here to help you, with your healthcare needs. And even if it's just navigating the system sometimes, dealing with a pharmacy or a specialist, and trying to help you get your voice heard.
Yeah. Adrian's with us right now live as well. And Adrian, on a typical day like this morning when folks start calling, I mean, give us an example, a quick example, one or two of the kinds of issues, your patients, Dr. Trudy's patients and your patients, may call you about.
Yeah, so I have a good example this morning. Actually, a patient who I've been seeing, I've probably seen twice in the past couple of weeks for kind of the same issue, but is having a flare up again. And, in this situation, the patient can email me and quickly set up a meeting to get the problem taken care of, or, get more of the preventative care versus if you were going through a traditional practice that's billing insurance. There's a lot of barriers to being able to quickly get care. So I think it really helps a lot in that scenario.
Yeah, absolutely. Dr. Trudy, before we let you go, I have to ask you about all these weight loss drugs that everybody wants to get on, the miracle drugs. And I guess, they go by Ozempic or Wegovy, Zepbound, semaglutide, I guess is the more medical term for some of these. What's your sense of them?
Well, at Balanced Physician Care, one of the things that I try to have as our core philosophy is we're all about solutions, and while nothing ever works in isolation, I think they're a tool that are a part of a larger healthcare program, diet, exercise. And for some people, they've been doing that and they're really struggling. They have genetic, family tree issues with insulin and sugar, and they've been doing all the right things, but they're still very frustrated with the numbers, and they want to live a healthier life. And so I think these medicines are a very good tool. And one of the unique things that we've done is, we've really looked at it, and we've, have compounding medicine solutions. I mean, if we can get a patient, this medicine, and it's appropriate, and we can get it approved through insurance, obviously that's the way we're going to go. But we have some patients where in reality that's still, not a possibility for them, yet this is such a turnkey. So we're again about solutions, and we do, provide and have access to, these medications in the compounding world for people.
Yeah, good options that are affordable, and of course, certainly recommended that you do this with a physician, that you can see and talk to, not just somebody on the internet, right?
Right, and I think that that's the biggest, barrier or negative thing about the compounding or this medication, is that if you don't understand the dosing, if you're not this has not gone through, certainly, there have been incidences of harm that the FDA is warned about. But, if you have close guidance and you're working with someone that you can call 24/7 at any time, if you're not sure about what dose you're supposed to take or what you're supposed to do, then, these medicines can be used safely and effectively. So,
Well, there you go. Any questions like that, or what's involved with this sort of membership physician practice that's going to get you a level of healthcare that I can attest that you probably have never experienced before unless you actually try it. You can start out by just getting in touch with them or reviewing the website balancedphysiciancare.com. That's balancedphysiciancare.com. And their offices here are local. If you're in a position where you can punch this into your cell phone, and you can just call and ask any questions that you might have or schedule that initial consultation at 904-930-4774. That number again for balanced physician care is 904-930-4774. Dr. Truty, any closing thoughts before we let you and Adrienne go?
No, like you said, Kevin, if this sparks your interest, just check us out. We do free 10-minute meet and greets for people who are just like, hey, I want to learn something more about it. So, again, we can be a real good health care solution for people who are looking for other things. Well, I hope you have a great holiday season, Kevin. I know it's that crunch time of year.
That's right. Well, Merry Christmas to both you guys. Thank you for your great work. Thanks for taking care of me. And we will talk with you both soon, okay?
Sounds great. Have a
Thank
great day.
you.